Welcome back, and thanks again for joining us tonight. The CDC now saying the effectiveness of the COVID-19 vaccine may weaken over time, and now there are new concerns over its ability to keep our seniors out of the hospital. According to data recently reviewed by a panel of vaccine experts, the shot appears to do a great job at keeping adults under the age of 75 out of the hospital. Even as the Delta variant skyrocketed, the vaccine remained 94% effective for that age group. However, for people over the age of 75, protection drops to a little more than 80%. Also new tonight, we have learned Moderna's COVID vaccine generated more than double the antibodies of a similar shot made by Pfizer. That's according to data published in the Journal of the American Medical Association. And with Labor Day weekend just days away, CDC Director Rochelle Walensky is telling those who are unvaccinated not to travel. Dr. Jessica Shepard practices at the University of Illinois, Chicago, and she's joining us live tonight to help clear up some of what is being said about COVID right now. Doctor, appreciate your time.
Thank you for having me.
Let's start with Labor Day. Should we be staying home, or do you think it's safe to travel?
You know, that is probably the question that we've had now for over a year when we're thinking of vacation time and what that means for people to travel. I do believe that we are still in a very precarious moment when we think of COVID, especially the Delta variant, where we are actually seeing ICU admissions increasing again, and of those are unvaccinated persons. So now that we have more mask mandates coming back into state as far as vaccinated and unvaccinated persons wearing a mask, that means that we are still at that rate where we can have high transmission, and we're seeing even more infectiousness with the Delta variant. So to answer your question, when it comes to travel, we really should take caution and really ask ourselves, is travel worth it at this time? Am I vaccinated? And really, where am I exposing myself, and making those decisions for yourself. But all in all, what we will see is that people will still travel. So still take precautions if you do decide to travel.
How concerned are you about this data showing the vaccine waning, especially for our seniors, considering how vulnerable they have been through this pandemic?
Yeah, you know, that is actually very troubling coming from a physician standpoint, because we did such a great job at making sure that the elderly really had much more access to the vaccine as it started to come out earlier this year. So we took care of our elderly because we know that they have immune suppression, and they also have decreased immunity sometimes against battling this disease. Now, what we are seeing, and that was revealed on Monday at the CDC when they had their advisory panel, is that keeping people out of the hospital is actually dropping slightly. Now, that is due to the amount of unvaccinated persons that we have. And so now with elderly, we really want to, again, keep that number down, but we are starting to see that number creep up a bit. So the message actually still stays the same, which is everyone to get vaccinated in order to benefit the greater good. And also, we are seeing increase in children having COVID and having those admissions to the ICU. So we're seeing both areas of the age, younger and older, starting to have admissions being increased. Message still remains the same. Let's get vaccinated.
All right, I hear you there. Finally, Moderna's shot looking like it offers more protection than the Pfizer shot at this point. How will this impact boosters in the months to come?
Yeah, that's a great question. Now, initially, it was Pfizer that had more of the range when we thought of the booster shot being 8 months after that last shot. So now that we're seeing more response, that actually is really good for Moderna. But still, for Pfizer, we do know that both of them are going to offer that booster shot. Now, what we do know in studies is that we'll start to see over time more of the response with that booster shot. It really just depends, again, at the study that was done, who was in that study, how many people were in there, and again, how they're actually measuring the response that they're getting for each of them. Nonetheless, if someone is offered a booster shot from either of those, it is highly recommended to take the one that you are offered.
I hear you. All right, Dr. Jessica Shepard, appreciate your time tonight. Thank you.